Hello everyone, my name is Aviv. I'm a radiology resident at Ichilov Hospital, and I'm part of MUCO. Our product was first conceived when we were doing observations in radiation wards in various hospitals. Meet Victor. Victor is a charming 80-year-old Holocaust survivor who's dealing with oral cavity cancer. During our observations, Victor told us that he hasn't been able to eat solid foods for the last 2 weeks, for the previous 2 weeks. So not only does Victor have to deal with the extreme side effects of being a cancer patient, both physical and mental, now he also has to deal with the side effects of his radiation therapy, of not being able to eat or drink. When we investigated this further, we realized that 90% of head and neck radiation therapy patients experience mucositis to some degree. Radiotherapy to the head and neck area helps deal with cancer cells. However, it also causes damage to the adjacent healthy tissue. So what does mucositis feel like? Imagine that you have an afta, also known as an ulcer in your mouth, and whenever you eat or drink or feel it with your tongue, it's really sore and painful. And now multiply it by 100. That's what mucositis patients feel like. They have trouble eating and drinking, and they have trouble swallowing, and it's really painful for them to even speak. So mucositis has a scale of severity. Severe mucositis is defined as not being able to have solid foods, and in extreme cases, not being able to swallow at all. This has very severe implications for patients. Many of them become reliant on opioid use. They have to be very often hospitalized, and they need feeding tube placement. Sometimes they may even become dehydrated because they don't notice that they cannot drink, and they get dehydrated without noticing it. Every year, there are 67,000 new head and neck cancer patients in the US alone. 60% of them will suffer from severe mucositis. This would cost up to $33,000 US per patient, and altogether, it will be $1.3 billion. So what can we do to help Victor eat again without debilitating pain? We can aim to reduce the severity of oral mucositis. So the first idea that we had in mind when investigating this issue was to, in some way, move the healthy tissue away from the tumor tissue. We learned that some solutions like that already exist. They are called spacers. But the problem is that the use is very limited because each one of these spacers has to be specifically designed to a patient by a dentist. This takes a lot of time and money, and that's why it's hard for them. It's hard to make them, and they are barely in any use. I want to introduce you to MUCO. MUCO is a one-size-fits-all device. It's an inflatable spacer that can be used in order to move away the healthy tissue from the cancerous tissue. It has three different parts. One part that opens the mouth, one part that moves each one of the cheeks away, and one part that moves the tongue away. By using MUCO, we can reduce the radiation damage to the healthy tissue, as you can see, and this can be tailored to each patient's needs and their unique anatomy. So our product has excellent technical feasibility. It's made of thermoplastic silicones that are cheap and easy to make. Our regulation will be in the 510(k) route, and our reimbursement will be in the B2B model. We will sell it directly to the hospitals. It has a unique design, and we plan to register a patent for it. So our value proposition is that this is an off-the-shelf device. It's always ready and available in the hospital inventory. But it has a modular design that's tailored to each patient's unique anatomy and tumor location. This is opposed to the competition, which takes a lot of time and money to make and is therefore in very limited use. So with this, we offer patients a way to go through their treatment safely and adhere better to it without getting out of the treatment in the middle due to mucositis. And for For healthcare providers, we offer a way for patients to finish their treatment faster and in better health. We plan to have our MVP by 2025 and start selling and marketing by 2028. This is our team. Thank you to all our mentors, and thank you all for listening.